description of what we do is similar to a school board. So the provincial government gives funding to us, and we provide it to a number of agencies across southwestern Ontario. Our geography goes from Long Point in the south up to Tobermory in the north. We fund 19 hospitals, 78 long-term care homes, the CCAC, which has been referenced a number of times, community support service agencies like Meals on Wheels, the Dale Brain Injury, Participation Lodge, organizations like that. So our total allocation is $2.2 billion. So it's a significant amount of money that we have responsibility for. And I should have started by thanking Southbridge Great Health Centre for having the session tonight. Obviously a big interest. And the other point that I want to start off with as well is that certainly appreciate, or the LHIN appreciates the importance of what hospitals mean to small communities. I've been in this role now for 8 years, I guess, and we've had other sessions like this, and the passion that comes from communities like yours supporting their small hospitals is so important, and want you to know that we recognize that. There's been a comment about local decision-making versus having close contact to the ministry. The decision-making around that $2.2 billion comes from us. It comes from our board. We actually have two board members here tonight, Barbara West-Bartley and Jerry Moss. Barbara's from Wyerton, Jerry's from Port Elgin. So there are local people that are involved in the decision-making process. So it is different than what happened having a connection with the Ministry of Health. And just in terms of an additional layer, I'm not here to defend the LHIN, but since I got the microphone, I'll do it. Previously, with district health councils, and the ministry had regional offices, the coverage of this geography here was about 90 people. In the LHIN, we have 42. So there's about half the people that are involved in the same process that was involved with district health councils and with Ministry Regional Office. And a big difference is that those two organizations didn't have decision-making powers. We do, our board does. So it's a big difference. We're easy to criticize because we don't provide frontline service, but do have an important responsibility in terms of how organizations work together. I won't repeat the history because Paul and John have done a great job describing what's happened to create the unit. But I want to make sure that the community understands where we stand and why it unfolded the way that it did. We were approached by the 3 hospital corporations plus the CCAC to look at providing this care across Craig Bruce. So a unit was created in Chesley, a unit was created in Owen Sound, together with the CCAC. We provided one-time startup funding to do that. But it was very clear in that conversation back in 2011 that we were not providing additional base funding. The hospitals agreed at that time that they would look for funding within their own organizations to make those 2 units viable. So we've been in that conversation. I think more recently with John and Paul. We met with the CEOs of the other 2 hospital corporations on Monday this week to look at additional options beyond the complete closure. I think if you look across how the health system is, what it's unfolded over the last 20 years, inpatient care is going down, outpatient care is going up. Restorative care is a bit different though. It's not about surgery, it's not about a medicine floor, it's about restorative care to get someone back, get their functional capabilities back up so they can live independently within their own communities. So, in saying all that, back in 2011 was very clear in terms of what the expectations were for us, as well as the expectations of the hospital. I think we're in a different spot now where the hospital, or the community obviously has seen the tremendous benefit that comes from a unit like this. That's where we'll continue to work with the 3 hospital corporations to find an option that'll make this feasible. I want to be clear, though, that I'm not here today saying that I'm going back to find $800,000. The hospital budgets across the province have been flatlined, as Paul said, for the last 3 years. So that $800,000 would have to come from someplace else. So that's the decisions the tough decisions that face the board, face us as a Southwest LHIN in terms of making these decisions. So certainly understand the tremendous benefit that's come from the RCU, and we'll do our best to find options that will hopefully sustain it in some form or another. And I'm happy to take any questions as well.
What's your operating budget
It's $6 million.
Okay. And how much money do you allocate to South Great Bruce?
What is your? 30 million.
30 million.
So that's, our operating budget is what it costs to operate our office and our staff and all things is $6 million. We provide $2.2 billion, so 99.7% of the money we get goes back out to the providers.
Just on a follow-up, earlier it was discussed that 53% of the people going through the restorative care unit were from South Grey Bruce, and that 47% came from Hanover, and that there was a little bit of and some other areas. And there was sort of an aside that no transfer of funds came from those hospitals. Is that sort of standard practice, or how does that work?
So when the project was initiated back in 2011, there was 3 hospital corporations involved. So Grey Bruce Health Services created a restorative care unit very similar to what is in Chesley and Owen Sound. So they're providing that service now, just as it's being provided in Chesley. And then Hanover was part of the original submission, but do not in any way pay for the services that are provided at either of the 2 hospitals.
Do you think that that might be an area where some funds could be found or transferred?
So again, we need to figure out what options are going to work. It's a relatively small amount in terms of the percentage. I think it's 15% of the patients are coming from the Hanover Hospital to the Chesley Restorative Care Unit.
But even 15% is still better than that.